So, Chair, the webcast has started now, Chair.
Okay, thank you, Angela. Well, good morning, everybody. Welcome to the September meeting of the Children and Family Scrutiny Board, which is now being held on Zoom and is being webcast live on the City Council's YouTube channel. Members should know as we go through the housekeeping that Zoom operates with the VPN switched on, so the paper should be easy to access. If I can ask all participants to keep their microphones muted unless they're speaking, just to keep the background noise down. The preferred approach is for members to keep their videos switched on when speaking. And if I could just ask everyone to double check that their names are entered into the system, particularly for elected members, that they would have their first name, then their surname, and then that they're a councillor. And officers are on hand to help with that if needed. If I can ask, where possible, participants use headphones with a built-in microphone, which again helps to keep the background noise down. And to aid the public in understanding the meeting, speaker view will be used for the webcast and will be set by one of the moderators. I will invite everyone to introduce themselves so that members of the public can follow this and know who everybody is. And sporadically, it would be very helpful if officer contributors could remind the board and members of the public who they are and what their role is, so it's easy to follow proceedings. We do have the option of raising your hand so that you can attract my attention, and that's the best way to do it. And as we do in the regular meeting, I'll call people to speak in the order that I see them. And we also have an instant messenger function. So if necessary, you can just send a message to attract my attention that way, although just bear in mind members of the public wouldn't be able to see that. If there are any technical difficulties, either if you let me know via the message function and one of the officers will be able to help you to get reconnected. If for any reason I experience technical difficulties, in the first instance, we'll just take a couple of minutes to try and get me back onto the call. If it looks like it's for a prolonged period, then with the agreement of the board, I've asked Councillor Stevenson to step in and chair if for any reason I'm away for a little while. And I'll assume the board is comfortable with that unless anybody wants to raise an objection, and I'll take silence as approval. Okay, thank you very much. So now what we'll do is we'll go around and we'll ask board members to formally introduce themselves. I'm going to go around in alphabetical order. So if you could be prepared and remember to unmute your microphone so we can keep things moving. So the first person I'm going to ask to introduce themselves is Helen Bellamy, please.
Hi, I'm Helen Bellamy, teacher representative.
And then Councillor Bithell, please.
Morning, Councillor Bithell, representing Kirkstall.
Kate Blacker, please.
Morning, Kate Blacker, a primary parent to governor representative.
Tony Britton.
Hello there, I'm representing the Roman Catholic Diocese of Leeds.
Thank you, good morning. Councillor Flynn, please.
Good morning, Billy Flynn, Councillor for Adler Wharfdale.
Thank you. Celia Foote, please.
Good morning, Celia Foote, teacher representative.
Thank you. Councillor Forsyth, please.
Good morning, Councillor Anne Forsyth, Finding Wortley Ward.
Thank you. Councillor Caroline Gruen, please.
Good morning, Councillor Gruen. I represent Bramley and Stanningley Ward.
Thank you. Now, do we have Emma Holmes? I think we were struggling to get her. Angela, any?
Chair, we will check on Emma Holmes. We may need to relay her apologies for today's meeting.
Okay, thank you. Councillor Howley, please.
Good morning, Chris Howley, Councillor for Wheatwood Ward.
Thank you. Councillor Mary Harland.
Good morning, Councillor Mary Harlan, Kippax and Methley Ward, substituting for Councillor Paul Drinkwater, I believe.
Yep, thank you, Councillor Harland. Always good to have you with us on this board. Councillor Hussain, please.
Morning, everybody. Councillor Hussain, Gipton and Hare Hills.
Good morning, Councillor Hussain. Councillor John Illingworth.
John Illingworth, representing Kirkstall Ward, Chair.
Thank you very much. Councillor Wyn Kidger.
You're representing Morley South. Thank you.
Thank you very much. Councillor Jess Lennox.
Morning, Councillor Lennox, representing Crossgates and Winmore.
Thank you. Councillor Marshall Catong.
Good morning, Councillor Marshall, representing Little London, Woodhouse and the City Centre.
Thank you. Councillor Renshaw, please.
Good morning, Councillor Karen Renshaw, representing Alcyon and Robin Hood.
Thank you. Councillor Stevenson, please.
Morning, everybody. Ryan Stevenson, representing Harewood Ward.
And finally, Jackie Ward, please. Are you there, Jackie? I think you might be still muted,
Yeah,
Jackie.
I'm on, yeah. So it's Jackie Ward. I'm the secondary parent governor representative.
Okay, thank you, Jackie. Okay, so we'll move into the agenda. I'll ask the officers to introduce themselves once we come to their items. Item 1, are there any appeals today, please?
No appeals, Chair.
Thank you very much, Harriet. Good morning to you as well. So, I'm sorry, I
Good
forgot to ask
morning.
you and Angela to introduce yourself as well. So
Okay.
would you like to introduce yourself, Harriet?
Yes. Good morning, Harriet Spate, Governance Officer to the board.
Thank you. And Angela, please.
Good morning, Angela Brogden, Principal Scrutiny Advisor to the board.
Thank you. Okay, so back to the agenda. So item 2, are there any matters that we need to exclude members of the public from today?
No exempt items, Chair.
Good. Any late items?
No late items.
Thank you. Now, do any members have any declarations of disclosable pecuniary interests? I'm not seeing any hands go up, so I'll take that as a no. And I know we do have some apologies, Harriet.
Yes, Chair. So apologies have been received from Councillor Drinkwater, with Councillor Harlan substituting today. And we've also received apologies from co-opted members Andrew Graham and Debbie Riley.
Okay, thank you very much. So item 6 then, we move on to the minutes of the previous meetings. We've got 2 sets of minutes to approve. First, I'd just like to check that we're approving them for accuracy, and then we'll go through any matters arising. So first of all, we had an ordinary meeting of the Scrutiny Board on the 8th of July 2020. I don't know if I could have a proposer and a seconder. I'll look for people raising their hands to say that they're happy that they're accurate. Or if anybody wants to say they're not, if you speak up. I've seen Councillor Forsyth put her hand up. And Councillor Stevenson, thank you. Okay, so I'll take silence that everyone agrees that those minutes are accurate. Thank you. And then we need to do the same for the call-in meeting of the Scrutiny Board, which was held on the same day, the 8th of July. So if I could have a proposer and a seconder that those minutes are accurate. I'm not seeing any hands shoot up. Oh, I'll take it that the silence means we're happy with them. So Councillor Forsyth, thank you very much. Okay, and would anyone like to raise any matters arising from the ordinary meeting minutes? Okay, I'm not seeing any hands. So if we move on to the call-in meeting from the 8th of July, are there any matters arising from those minutes, please? Okay, I'm not seeing any hands. So we can move on to the substantive item. So we are moving to item 7, which is an update on the coronavirus pandemic response and recovery plan. There are a number of officers. We have Councillor Jonathan Pryor with us, Councillor Venner, Sal Tariq, Julie Longworth, Sue Rumbold, Val Waite and Dave Clark. I'll ask them to introduce themselves and their roles in a second. But Angela, would you just like to briefly introduce what we're going to be discussing, please?
Yes, thank you, Chair. Well, previously the Scrutiny Board had considered the latest update reports from the Council's Chief Executive on developments surrounding the Council's overall response and recovery plan in relation to the COVID-19 pandemic. But at today's meeting, the Board has been provided with a report from the Director of Children and Families, which presents an update of the ongoing progress that's been made by the Children and Family Services Directorate, working with partners and communities in response to the COVID-19 pandemic. Following the board's discussion today, members will be asked to consider whether there are any particular issues or areas that they would like to focus on in more detail as part of their future work schedule, and to note that there is already a more detailed update surrounding schools and their recovery plan that's scheduled for October. Thank you, Chair.
Thank you, Angela. So just initially, for the benefit of board members and members of the public, if I could just ask the executive members and the officers to introduce themselves and their roles. If I could start with Councillor Pryor, please.
Morning, I'm Councillor Jonathan Pryor and I'm the Executive Member for Learning Skills and Employment. Thank you.
Thank you very much. Councillor Venner, please.
Hi, good morning everyone. I'm Councillor Fiona Venner. I'm the Executive Board Member for Children and Families.
Okay, thank you. Sal, please.
Morning everyone, I'm Salim Tariq, I'm Director of Children and Families in Leeds.
Thank you very much. Julie Longworth, please.
Morning everybody, I'm Deputy Director for Children and Families in Leeds.
Okay, thank you. Then Sue, please.
Morning everyone, I'm Sue Rumbold, I'm Chief Officer for Partnerships and Health. Good morning.
Thank you. Good morning. Val, please.
Good morning, everybody. I'm Val Waite. I'm Head of Learning Inclusion.
Thank you. Good morning. And finally, Dave Clark, please.
Good morning, everybody. My name is Dave Clark, and I'm the Head of Learning Improvement with Leeds.
Okay. Thank you, Dave. Okay. So, I'm really open now to. I'll open up to Councillor Pryor and Venner and Sal initially to introduce the report, and then we can go into questions and comments from board members. So who's going to kick off today, please?
Shall I start?
Oh, yeah.
Yep, by all means.
Yeah. Okay. I'll just make a few introductory comments covering the health and social care elements of the report which fall under my portfolio. First of all, I just want to pay tribute to the continued absolutely excellent work of the Directorate and just the passion and commitment and creativity of the staff that has seen us through the last 6 months, and just the dedication that everyone's had to looking after our children and families during this period, particularly some of our more vulnerable children and young people. The report references the value that there has been in the practical support the Directorate's provided through the early help hubs, things like providing food, nappies, and basic essentials that people during this time, and breaking down some of the barriers people might experience in getting support from a council. And that's been really important at a time when schools haven't been open to most children, which is the route that most referrals would come to children's social care. We've had continued fantastic placement stability in relation to foster carers and children's homes. They really have dug in to make that work during this challenging time. And I may have mentioned at the last meeting, we've had a huge increase in interest in fostering, which has been the case in other areas as well. I have a regular meeting with my equivalents in Yorkshire and the Humber, and actually that's been the case in a number of areas. We registered 97 inquiries about fostering in 1 month alone. I think people have been re-evaluating their lives either through necessity or because they've had time to reflect, and in the same way there's been an increase in people applying to train to be nurses. There's been a huge increase in people applying to be foster carers, which is really good because we are anticipating a big increase in the number of children looked after, but not in the way you might assume. You will have seen in the news the humanitarian crisis of unaccompanied asylum seekers in Kent, unaccompanied asylum seeker children. So in excess of 430 children have arrived in Dover this year, and that's got to the point where Dover Kent Council have said they can no longer safely accommodate any more unaccompanied asylum seeker children, and they're currently being looked after in inverted commas by border control and intake centres, which is just not at all where you would want traumatised children without their parents to be. I'm really proud that Leeds is one of the around 50 councils that has stepped up and said we will take more unaccompanied asylum seeker children. But that does mean our looked after children numbers will go up, but we will obviously be able to disaggregate that, and we will be able to see where the number increases, where we've played our part in responding to this crisis, and where, if it's an increase in children that are coming into care from the Leeds population due to abuse or neglect. We've continued to have our early years Zoom calls with early years providers throughout the pandemic every few weeks. They've continued to feel fairly neglected as a sector in terms of guidance, so it's felt really important that we provide that locally. And with reference to the situation we're in currently in Leeds, where the growth in infections of COVID are in the younger population, our youth service has continued to work with the police, supporting them in managing non-compliance amongst younger people. And we're using both the youth service and Child Friendly Leeds to get messages out about the importance of staying safe during this period. They're all the comments I'll make as by way of introduction. I just wanted to pull out a few points, so thank you, Chair.
Thank you, Councillor Venner. So, Councillor Pryor, is there any opening remarks you'd like to make, please?
Yeah, of course. I'll just briefly go through kind of the world of education since we last met before the summer. Obviously, schools were being closed over the summer, so the biggest event was obviously the exam results. I don't think I need to go over those in detail. I'm sure people follow the news, but certainly in Leeds, we really welcomed the U-turn from the government. I think it was the right thing to adjust how the grades were being monitored, and actually before the government did that, we had quite a bit of contact from concerned schools. So obviously schools are, some started coming back last week, with most this week. There's been a huge amount of work producing risk assessments, working with our health and safety team over the summer to get schools ready for that. Officers have been in regular contact with heads. There have been obviously a few isolated cases where people have tested positive, which has delayed the opening of a small number of schools. But so far, a lot of our strategies to limit closures have been successful. We're trying to keep things to bubbles, so it means as many pupils can come back as possible. And actually what we're not seeing is one positive case becoming an outbreak. We're not seeing that. So that does show that a lot of the safety measures that were put in place seem to be working in schools. We had a Zoom call on Monday with head teachers, specifically on some of the public health stuff. We have a second Zoom head call on Thursday, which will be covering more health and safety, obviously, but then a wider range of issues that heads want to raise. And at the moment, the teams are developing and implementing wellbeing for education return. And this is going to be a package of resources that can be delivered to schools and settings to kind of help them get the kids back into school. I do want to, just in my opening remarks as well, just pay tribute to the teachers and the heads who have done a phenomenal job since the start of the pandemic. But even over summer, the amount of work they've had to do to prepare to come back to school has been phenomenal. You know, they're preparing not just for the physical health of children, but also for the mental health, and kind of working how we get kids back into a routine, back into learning. And I'm sure those discussions are going to go on throughout the year as we work out the longer term effects of the past few months. But I'll leave it there for now for introductory remarks. Thank you.
Okay, thank you, Councillor Pryor. And then finally, if I go to Sal for any introductory comments from you, and then we can get into questions. So, Sal.
Thanks, Councillor Lamb. Yes, so I think we've got quite a comprehensive report that people will have seen and read, and that covers most of the issues. I'd just like to reiterate my own appreciation for all of the work that staff have done over this period of time. It really has been an outstanding response from staff right across the piece, and as both Councillor Venner and Councillor Pryor have reflected, the effort that people have made to support our communities has been incredible, and a particular thanks in addition to that to head teachers who have made a tremendous effort to keep schools going over this period of time. in Leeds, slightly different to a number of other places. We really started back at school on Monday with a small number of schools that opened just last week. Monday was an inset day in many schools, and so Tuesday was really our first day where we were aiming to get as many schools open as possible. We've agreed that there would be some phasing of return to school where it was felt necessary, and particularly when you've got children who are coming to the schools for the first time, either in reception or when they're starting secondary school. And so there is a little bit of phasing going on in order to ensure that as pupils come back in, as parents start to bring their children back in, that the systems and plans that schools have come up with are given an opportunity to work effectively. I think all the way through this process, what we've tried to do is to develop as much confidence in the system as possible, and so getting those things right at the beginning is vitally important. But I've been impressed by the commitment that people have got to trying to maintain schools open as much as possible. So by the end of this week, we'll have 97% of primary schools open, and by next week, all the primary schools will be open, save for some phasing, as I've explained in reception year. And this week, 76% of secondary schools will be open, with all of them open by next week. We've had 9 schools where there have been various levels of issues around either teaching staff or pupils testing positive for COVID. We've unfortunately had to have one school closed for this week, and partly that was to do with the head already being off work, and the fact that the school has a small number of staff where there had been some contact between them in the preparation for opening this school. So we're hopeful that that will be fully open again next week, but unfortunately, despite valiant efforts, we haven't been able to safely open that school this week. All the other 8 are continue to open. I mean, 6 of those, there are no issues, given that those people who have tested positive have had no contact either with staff or pupils. In one school, we have had a bubble that has had to self-isolate, and another school where there's been no operational issues. So we're working very closely with the schools. I think there were some issues over the weekend that people may well have seen nationally around access to Public Health England. That was related to a technical issue with the phones, and we certainly had some difficulties in making contact with them, but that has been resolved now, and whilst there was a backlog at the beginning of the week, all of the schools that have needed to have either had a conversation with Public Health England and or by Monday, our own public health staff here locally had been, and health and safety staff had been in touch with those schools, so they have the up-to-date advice in all of those circumstances. You may also have seen that there are some issues around testing capacity, and we understand that actually some of that backlog is to do with capacity in turning around the number of tests that are now being undertaken from the labs. For the schools, we have arranged locally additional capacity in order to ensure that if a school locally needs to undertake a number of tests, that we've prioritised some of our capacity to be able to meet that need, and we've written to the schools to inform them of that. Just on the social care side, we've got a number of calls with others up and down the country, actually, just to see how things are progressing from a social care point of view. You can see in the report that demand, despite the schools not being back, has been somewhere near pre-COVID levels. We are monitoring that very closely and carefully. We do expect that there will be an increase in demand for social care services, but we are monitoring that very closely, and people are geared up to respond in the way that we normally do. So I'll leave it there, Councillor Lamb, if that's okay as an introduction, and the team are available for any more detailed questions that people might have.
Okay, thank you, Sal. That's really helpful. So we're going to go into questions. I've got a few hands going up already. It doesn't put them in order for me, so I'll take them as I see them. Just by way of reminder, in October we are scheduled to have a much more detailed update around schools, because we anticipated there wouldn't be a full picture of data quite so early in the term at this stage, but that's not to say we can't ask questions about that as well. And also what we're looking for at the end of this session is for any areas of work that we might want to look at in a bit more detail through the work programme as the year progresses. So we'll be looking out for any particular themes that come up. So the first hand that I saw go up was Councillor Gruen, and if you leave your hand raised on the screen if you're wanting to contribute, and I'll bring you in the order I've seen. If your point is covered, then feel free to take it back down. So over to Councillor Caroline Gruen, first of all, please.
Thank you very much, Chair. Actually, you have outlined what I was going to say. I'm very interested to hear on the update about schools, but it is incredibly early and some haven't actually had all of the children in yet until tomorrow. So I was really going to make the point that I'm very, very interested. Obviously, health comes first. And the most important thing is that we've heard today the massive preparation that schools have gone through in order to keep children safe. But education is also important, and I'm very interested to understand, for example, the level of attendance as children have returned, their ability to return to the curriculum and a learning routine, and how all of that is going, because that's the bit that I perceive through the two schools I work closely with as a governor that is going to be the most difficult hurdle to overcome. And I just want to restate how hard those staff have worked in schools, and particularly actually the leadership teams, many of whom, although it was agreed that they would have a summer holiday this time, have actually only taken a few days and have been in school sorting out those things all of this time. So, you know, it's really well done to them and to the staff who've been in as well. But I do think we will reach a point, and the chair has pointed out that will probably be at our October meeting, but I was going to suggest you might want to give us a little bit of a written briefing before then as to how these first few weeks are actually going with regard to learning. Thank you, Chair.
Yeah, thank you, Councillor Gruen. Who would like to respond to that, please?
I'm happy to, Councillor Lamb, just to say thank you, Councillor Gruen. Appreciate your support for the leadership teams and all of the school staff. We have set up local arrangements to monitor attendance as we go forward, and I'm in conversation with the Department for Education on a daily basis at the moment as well, because there is a centralised system being set up for monitoring attendance. So as you've identified, some schools aren't back yet, and so it's difficult to assess what that's looking like immediately today, just based on the timing. Happy for us to put a report forward prior to the meeting next month when we've got a bit more of an accurate picture, but suffice to say that we are monitoring it closely. We've got our own local systems as well as the information that we will get through the Department for Education, and our intention is to work closely with schools, our early help staff, to really support children to get back into school. That's the priority across the system, really. You know, as you've said, health comes first, Once those arrangements and the risk assessments and all of that are in place, it's then for everybody within the system to provide that support. And I think that point I made about having confidence in the system is where this becomes more critical. And as people go in and experience the well-laid plans, I think that develops more and more confidence, not only for those parents that have gone, but maybe those that are holding back a little bit. But we'll keep a close eye on it, and we'll be supporting as many children back into school as possible.
Thank you. And I'm assuming that will include academies.
Yes, absolutely. Our support's available across the board, and the monitoring of the data is across the board.
Thank you.
Councillor Lamb, could I just add into a little bit there from Sal?
Yep, go ahead, Dave.
Just to mention to Councillor Gruen that actually through the bronze groups that we hold with representatives of school head leaders are starting again from next week in our Zoom meetings. So actually the points you were raising in terms of the curriculum, the learning, the impact, how that's all going, we'll start to get a good sense of how that's going over this next couple of weeks. And also, as part of our ongoing support, our officers will be contacting head teachers and having those personal conversations with them over the next few weeks to see how things are going. So we'll get some more feedback from them about how things are going there.
Thank you.
Okay, thank you, Dave. So next I had Councillor Flynn, please.
Thanks, Alan. Probably for Sal, I think, and with the caveat that a number of other people have mentioned this morning about it's very early days yet. Sal, I know it's a relatively small number of children who are shielding themselves, but also those that have members of the family that are shielding. You did emphasise before that health was the most important part of all of this. I just wondered if there was anything at all by way of data as to whether the children who are in those categories are back at school yet, and if they are, have there been, as yet anyway, any implications?
So,
okay, Sal?
Yeah,
sorry.
We've sent out clear guidance about how schools should be working with this in terms of making judgments about those children and young people who are shielding. I haven't got any immediate data as yet about what that picture is looking like, but in my bulletins that are going out to heads, we've sent out clear guidance about how that should be being dealt with. I know we've got Sue Rumbold on the call. I don't know, Sue, if there's anything you've got that you can add at this stage.
Thank you, Sal. Yeah, just to say that to reassure everyone, at the moment, every child that was on the shielding list, and you see from the report that was over 1,400 children initially identified in Leeds who were advised not to attend school. Those children have now been told they can attend school. However, for parents where there are concerns, their advice is to talk to their GP or paediatrician. And we have had some examples of instances. We had a call with the Silk principals yesterday where one child has been advised not to go to school by the paediatrician because of the nature of their medical condition. So that's something that the school is supporting the child to be at home and putting a home learning package in place for them. At the moment, every child on that list is being reviewed by a paediatrician or a GP, and a decision is being made about whether they should remain on the shielding list or not. If the child remains on the shielding list, the advice currently is that the child should attend school subject to a risk assessment and also subject to the clinician's advice that that child is safe to attend school. So that list is currently, GPs are working through that list at the moment, taking advice from paediatricians as well. And we are awaiting the information as to how many children will remain on the shielding list. But as you know, shielding has been paused at the moment. That may change. And it's an ongoing situation all the time. But currently, the children that are on the shielding list, where it's deemed that they are safe and their parents and the clinicians are happy that it's safe for the children to attend school, are attending school. Schools were all informed, as you see from the report, about every child that was on the shielding list on their school roll. And I know head teachers were really grateful for that information because it enabled them to ensure that there was their risk assessment and those children were being supported if they were attending school. And some parents did want their child to attend school. GP agreed that then the child could attend school subject to a risk assessment. So it's a constant ongoing issue, Councillor Flynn, but something that we're keeping a really close eye on. I'm working closely with the central team that's leading on shielding for Leeds, and we are updating all that information constantly. So I've informed the head teachers yesterday in the briefing that as soon as we've got the updated list of all the children who were to remain on the shielding list, we will inform them immediately so they know. And as I say, if there are any children who are deemed to be too clinically vulnerable, then a letter is being sent from the clinician to school to advise of that. So that's the position we're in at the moment.
Okay, thank you, Sue. I had Val that I think wanted to come in, and then I'll see if Councillor Flynn wants to follow up. So Val,
Yeah,
please.
Just in response to Councillor Flynn, morning Councillor Flynn, for all of the children that are not yet able to attend school because of medical conditions, there's an absolute commitment to provide education for those. We've set up various systems now and working very closely with schools that we can do that, either by sending packages home or where young people can get online, sending information home, teaching home, links into school so that they can still access education. For all of those with education, health and care plans, the duty now to absolutely provide the support that is identified within an education, health and care plan has now come back into force. It was relaxed over the period of lockdown. It's now back in force. So for all of those learners who are in school, who cannot attend school now with an education, health and care plan, there's a duty to provide that education. So we're working very closely with our mainstream colleagues and with our colleagues in specialist education to ensure that they do get the full package of support. Thank you.
Thank you, Val. Councillor Flynn, did you want to come back, or are you happy?
Yes, very briefly. Good morning, Val. You knew where I was going. Obviously, you know me better than I know myself, I think. Yeah, I just wanted to be absolutely reassured that the children who can't go into school for whatever reason, and particularly those on plans, are getting the education that they actually need, rather than you know, what can be supplied, as it were. You know what I mean, I think, by that.
Yes.
And what sort of safeguards are in place to ensure that the children are actually getting the full benefit of the education they should be getting.
Yeah, absolutely. And as you say, anticipated that question because that's been a focus for us. And certainly now we are looking direct contact with schools, identifying those children on the list, so correlating it with the list that Sue has in terms of shielding, but also other learners, either because of anxiety that as yet need support and encouragement to go into school. We are working with those schools, with those families. We've got our attendance team that are also working with the schools so we can put that support in place. And then as an interim, the packages of education that can go home to support the education. So there's continuity, because we're well aware that they're some of our most vulnerable within the city and they're a priority for us.
Okay, thank you very much, Val. I've got quite a number of people with their hands up, so please be assured I can see all of them, and I'll just go through them in the order that I've seen them go up. So the next person is Helen Bellamy, please.
Thank you. I just wanted to make a comment and ask a question about individual risk assessments for school staff. Now, obviously, from the contacts we've had as a union from our members, the majority of schools have got these in place, but we still have had a handful of members contacting us on Monday and Tuesday this week with no individual risk assessments in place, and these have been Category 1, Category 2 and Category 3 members of staff. Occasionally they've been in schools that are maybe not that receptive to working with unions as well, so that can make things quite difficult for those members of staff. So I was just wondering whether the council could maybe send out another message, making it, I'm sure you have done this already, probably a number of times, just to make it known to schools that it's essential that these members of staff have their individual risk assessments. And also regarding PPE, if these members of staff desire to wear a mask and it's deemed that that would be a mitigation for any disability or health problems that they have as part of their risk assessment, are the council supporting this?
Thank you. So is that for Dave or Sal or Councillor Pryor?
Yeah, I can come in on Councillor Lamb. Thanks, Helen. In terms of all the risk assessments, yes, we've been supporting schools through the health and safety teams and their regular bulletins and their regular information out to schools, and so that schools are aware that they need to be carrying out those individual risk assessments. And I think by all means, we can send that message out again through the bulletins and and I can relay that back to our health and safety teams. I think in terms of those individual schools, when we've met with trades union colleagues throughout this, on a weekly basis, we've pretty much said that if there's very specific schools where there may be one or two schools that have not carried out something, or there's specific members of staff, for them to come back to, for the unions or the members to come back to HR, to health and safety, and we'll sort of like follow that up. So on individual cases, and I think, like you say, generally schools have worked tremendously hard to get those individual risk assessments in place. If there's some individual cases, we can support and have those conversations with schools to support them to get those in place.
Thank you, Dave. Helen, did you want to come back, or are you happy with that response?
Yeah, thank you for that. I think my biggest concern is in one or two schools that are not that receptive to working with unions and are quite defensive if they're maybe approached individually. I think school leaders are stressed, so I do understand that they're in very difficult circumstances, but that's why I was asking that maybe another broad reminder could go out to cover those. And then also just on the face masks, because we do have a couple of members who are really keen to be able to wear those who wear shielding.
Yeah, I think we're happy to work with those schools where there may be a specific issue to support in getting something in place. In terms of face masks, if it's part of that risk assessment, then I think some staff would be wearing those if that's part of them being able to work in schools. So again, we can work individually with schools on those through the health and safety team and their HR teams.
Okay, thank you, Dave.
Thank you.
So next is Celia, please.
Thank you, Chair. Morning, and it's about transport, and mainly silk special schools, but this might also apply to some children who are shielding in mainstream. And it's the fact that within the school, a silk, the pupils are in a bubble. Is that bubble able to be replicated when they're being transported home? Some teachers and I think some parents quite probably are concerned that they because of the complexities of getting pupils around the city, that those bubbles can't be maintained on the transport. And then just an extra, if I may, and it was prompted by Councillor Flynn's question, have any of the government promised laptops been received yet? Because I'm aware that some of the pupils that might be shielding and staying at home may be in need of being supplied with the technical equipment. Thanks.
Councillor Lamb.
Thank you, Celia. Yeah, Dave, over to you.
Could I come in just initially on the laptop issue? And I'm sorry for jumping in. I can't find my hand up button, I'm afraid. I'm sorry about that. And but on the laptops, the government there's been the initial outlay, the initial program of getting laptops out to young people, some through the social care side. There's been 363, I think, sent out through to year 10s. The government have announced the next phase of that, and they've asked schools to prepare for those schools where children are not able to be in school. They may be self-isolating and need to be working remotely. And the criteria for that will be if they haven't got a laptop or a tablet at home, or if they're having to share one, or if they've only got access to a smartphone rather than a tablet. And the government are promising that under this new system, schools will be able to order that and they'll be delivered to the school to allocate to those young people within 2 days. So the government have so far asked schools to prepare prepare a list of children that might apply to should they need to order something over this next period of time. So hopefully that will help allay some of those concerns, and particularly Councillor Flynn was mentioning about those children working at home, that actually there's a system being rolled out that should support that.
Just come
so
in.
I think Harlan, Sue, sorry, yeah, go ahead. Yeah.
Apologies, like Dave, I can't put my hand up either, but just to reiterate that we have had, I think, more than 1,200 laptops and devices delivered, and they have been distributed, working really closely with schools, with clusters, social workers, early help colleagues. And I suppose it's not just about the distribution, but it's also then about supporting families, supporting the children around, as Val has talked about, packages, and a whole range of resources that they can utilise alongside the devices and the laptops, because some of it is about confidence actually, and technical knowledge. So there's been support right across the board.
Okay, and I think Sue wanted to come in as well on this.
Yeah, just to respond to the question around transport and bubbles, absolutely, we recognised very early on when we were planning for the return in September for transport about this challenge of maintaining bubbles on transport. We did have lots of conversations with Department for Transport as well, and wherever possible we are maintaining bubbles in transport with the same bubble that the child is in school. However, it's not always possible because of the routes and the way that the journeys need to be planned for children. We do have PPE available on all of our transport, and including taxis as well, so that's a requirement for children who are transported. And so we've been very clear. Now yesterday, when we had the Silk Principal meeting, the feedback from schools was positive around the transport arrangements that have been put in place to date. So we do acknowledge that there are some challenges around trying to maintain those bubbles, but we've taken every precaution possible to ensure that that children are kept social distance on the transport. So we've put additional buses on to enable that, and also that PPE is available to keep children as safe as possible when they're being transported, not in the same bubble. So it's just been a logistical challenge to ensure that we've got as much of that in place as possible. But we, as I say, yesterday the feedback we got from the Silks was very positive.
Thank you for those answers. Thanks.
Okay, did you want to follow up, Celia, or are you happy with that? And Helen had asked in the chat if individuals or organisations have laptops they no longer need that have been replaced, there's an opportunity to pass these on to pupils in need. The officers can come as well, but I'm aware that's something we have done. We've been working with some private organisations in my ward to arrange for laptops and computers to be refurbished and passed on to families that need them. So it is possible, and there might be, of the thousands of people I'm sure who are watching our webcast this morning, people who've got things that they could pass on as well. So next is Councillor Renshaw, please.
Thank you, Chair. I'd just like to ask if there's any systems in place for tracking and tracing within schools, not only with the pupils, but with the teaching staff or all the staff in school. And obviously there's been not much clarity for parents to really understand about bubbles and who their children are allowed to play with, considering that they've got to keep groups to 6, but yet in school there are 30 in a bubble. So I just wondered if there was any clarity going out from Leeds Council to the parents and staff over what that will entail or incorporate. And are the government providing any further funding for the tracking and tracing to be set up, or towards all the added actions that thankfully Leeds Children's Services have provided? Thank you, Chair.
Thank you, Councillor Renshaw. I don't know who wants to pick that up. I assume schools still take registers these days, so I would imagine they'd have a list of who's in and not in on any given day. But Dave, is that one for you?
Yeah, I mean, I think in that initial thing about Councillor Renshaw about the track and tracing the bubbles. So in terms of Leeds itself providing information to parents, it's very difficult for us to do that blanket letter, which would actually probably cause more confusion, because all the schools have got very specific numbers and ways of operating. So they've done their very comprehensive, robust risk assessment. So they've got their bubble set, and they should really be telling parents how that's operating within their school. And then if there is, for example, a positive case within one of their set bubbles, we've got some standard letters that schools can utilise to inform parents of whether it's if it's a positive case or if it's a negative case, or what action needs to follow. So we've supported schools where we can with the comms to parents. But in terms of telling parents how it's actually operating within that school in terms of the bubble, it's very difficult for us to give that, because they'll all be slightly individual and unique. Schools, just to say, have they've got access to all the normal track and trace system for that the public have. Schools have also been supplied from the DfE with an emergency set of 10. They've all been provided with 10 test kits for children or that show signs of COVID whilst at school, and where they think that actually it'll be difficult for them to get a test, or if they're sent home, it's very unlikely that the parents would be able to get them tested. So it's another backup in terms of, I know there's issues in terms of capacity at the moment with the test and trace, so there's another backup for schools as an emergency to get those children tested.
Thank you, Chair. I'd just like to say it might be useful to try and get the mobile tracing system, or the mobile vehicles that have been doing the tests, into sort of school grounds where parents can go, because quite often it's difficult for parents to get access to where the location of the vehicles or the tracking and tracing is taking place. So I know in my ward, it's been done at St George's Centre. That's the nearest location, but for many of the residents in Housing Robin Hood, there's no direct public transport that could get them there. So I just wondered, rather than that, maybe if there are some of the larger schools that the tracking and tracing could go into the school ground and ask anyone who feels that they've got any concerns if they want tracking and tracing.
It's Councillor Renshaw, it's potentially not my area in terms of the track and trace and how that would operate across the city. The only concern, I guess, with doing things on a school site would be that schools have been working tremendously hard to put in place really secure risk assessments where we're not encouraging additional people onto school sites. So it'd have to be that, that would cause issues of sort of encouraging more people onto a school site. So I think that's something that would need to be considered really carefully.
Yeah,
So I think you're muted, Councillor Renshaw.
I keep on mute.
No, we haven't got you. No, I was struggling a bit. We'll move on, Councillor Renshaw, and we'll come back to you if there's a chance.
Okay.
So thank you very much. Councillor Stevenson, please. Thank you.
Thanks, Chair. Just on shielding, can I have a bit of further guidance following Councillor Flynn's point? So we know what happens where a child needs to shield and the GP says that they should. What happens if the child is cared for by people who are needing to shield for medical reasons? Is that child safe to go back to school? Can the child stay at home in those circumstances? I have a piece of casework that points to that at the minute. And also on risk assessments, following on from Helen's point, Para 3.5.3 of the report says schools have completed comprehensive risk assessments so they can reopen safely to all children. As we sit here today, I don't think that's a factual statement in this report. There's already some stuff in the press today about some schools not being able to open, pointing to that, to risk assessments. So how are we going around to check that every school has done that? Are they lodging those risk assessments with the local authority? And linked to that, the final point is, there will be instances, as there already have been, where schools can't open because too many teachers, staff, senior leadership have to isolate. So what can we do proactively in case that happens again to make sure we have some sort of bank of staff ready, senior leaders ready across the council to jump in where we need to have not just classroom supply teachers, but responsible individuals in the school who can account for the actual running of the school should a whole senior leadership team be taken out. I don't want to go into details of individual schools. I'm just thinking holistically across the council whether that's something we can start looking for. Thanks, Chair.
Thank you. So I think Sue probably would come in first on the shielding aspect.
Thank you, Councillor Lamb. Yes, advice is that any child who's living with an adult who is shielding is able to return to school. But again, the caveat for that is that if it's deemed to be safe by, I guess, the adult clinician, and depending on the circumstances, I mean, we've had some cases where there are adults who are, end of life care and are very concerned about their children going to school and potential for them bringing the virus back into the house. So that it is very much on a case-by-case basis. And the conversations would be with the family and also therefore with the school of the child. And again, a home education being provided for the children who are not attending school for those particular reasons. But just to reassure Councillor Stevenson that absolutely those conversations are being had, and I'm talking to my adult colleagues about that. And any cases that come up, we have got systems in place to enable us to ensure that the right decisions are made in each circumstance.
Thank you, Sue. And then probably looking to Dave or Councillor Pryor to pick up the second part of the question.
Yeah, if I pick up those 2 points, one about the health and safety. So in terms of the health and safety, so we're reliant. I mean, schools are responsible. So head teachers, governors are responsible for making sure that they've got really robust and appropriate risk assessments. And like you say, Councillor Stevenson, there's a couple, or certainly one at the moment where it's not been robust enough. In terms of risk assessments, we've asked risk assessments to be published online. It's very difficult, I guess, for us to say that the council will collate all those risk assessments because with 270 odd risk assessments coming in, I don't think we could physically go through all of those risk assessments to assess the quality of those and whether they are robust enough for their unique school. Because I think it's not just a case of reading that risk assessment. It would actually, because they're so unique as schools and each of the locations and the numbers and so on, you'd need to be on site to go through all that risk assessment, I guess, to make sure, if they've put, only so many children to go through this door, you need to know where that door is and where, and so on and so forth. So what we're relying on therefore is the head teachers to be carrying out their responsibilities effectively, the governors to sign that off. I mean, the other thing is maintain schools are utilising the Leeds risk assessment documents. The majority of, I think, of academies are also, although they don't have to use that, so they would be using a different risk, could potentially be using a different risk assessment. There's support regularly for head teachers from our health and safety team in Leeds, and they've been supporting all schools regardless of whether they're maintained or academies. They're monitoring over the next period of weeks 25% of schools, and then what we've tended to do, where there's schools where we may have picked up some concerns that things are fully in place, to actually ask health and safety to be in touch with those schools to have those conversations and maybe those visits out to them. The government have also announced that the Health and Safety Executive are going to be contacting all schools across the country to monitor the robustness of plans. So we're just awaiting further information from the Health and Safety Executive, but that looks like a national programme, a national drive that's going to be looking at that. So that's in terms of risk assessments. In terms of, you're right, it would be, in terms of the staff, I mean, one of the issues, the complex issues is in terms of if you've got a number of school leaders which are particularly important. It's sort of easier to like shuffle if you've got a member of a TA or a teacher that has to self-isolate. It's maybe slightly easier to shuffle things around so that you can get some cover for that, so that everything can operate as normal. Much more complex when it's senior leaders, and particularly if it's a large number of senior leaders that are not in school. We've just sent some sent some advice yesterday in the director's bulletin about making sure that senior leaders are very conscious about their social distancing, because in terms of how they're working together, because if, say, the head teacher has been in close contact with the deputy, the assistant head, and the other senior leader in school, there's the potential for all of those to have to not be in school, which causes problems. There's one school specifically at the moment that we're working with, in terms of they've got one of those issues where there's a number of senior leaders not in school. We've actually fortunately been able to utilise a couple of appropriate people from our learning improvement team to support the school through that period of time. Under normal circumstances, and we've started having those questions with other schools, we would normally try and sort of contract, maybe a deputy from another school or a head, or second somebody in or out. It's more difficult at the moment because understandably schools are thinking we need all our hands on deck. I need my deputy, I can't release my deputy to go and work somewhere else because I need them in a classroom, or if I self-isolate, then I need my deputy. And so it's more difficult, but we are looking at that of how we manage, or how we can support with supporting that school leadership so that things can operate as normal. So it's not easy by any means, and unfortunately there isn't a pool of heads and deputies that we can draft in, but we are looking at that. I don't know whether that answers the questions, Councillor Stevenson.
It does, thank you, Dave. One point I might look to is Ofsted inspectors and stuff. That's one area worth looking, I think. I just wanted to just check on the element of risk assessments. I know it takes a lot of effort to go through them. My only concern is it is the statutory responsibility of the local authority in terms of safeguarding of children. And I just wonder whether, if the question was posed to the local authority, how can we be certain that every school has done a risk assessment to satisfy our own responsibilities in terms of safeguarding. Could we answer that question today? So that was why I really asked the question.
Dave?
Yeah, I think in terms of it's the safeguarding, in terms of head teachers in governing bodies are responsible for their safeguarding and making sure that arrangements are fully in place for those within within their school, and then we need to have that oversight of it. And I think it's a conversation, like I say, I think it's particularly difficult to monitor all of those risk assessments. And I think by asking schools, I guess one of the issues is by asking schools to send the local authority their risk assessments, and we wouldn't necessarily get those from the academies either. But actually, just by the nature of asking them to be sent to us, there's that sort of natural assumption that we are going to monitor and check everything, and we sign it up. And I think there's that danger, isn't there, that if we don't want to be given that impression that actually we're going to go through line by line and check everything that's written down in that risk assessment is right. So there's that it's got to be that partnership between the health and safety teams, the schools and the local authority. But I think we can have some further discussions on that about how we best monitor that, Councillor Stevenson. It's not an easy question.
Okay, thank you, Dave. So next I've got Councillor Marshall Catong, please.
Thank you very much. But Councillor Stevenson has actually asked my question. It was regarding the shielding of another parent in the house of children going to school. Specifically, they were asking if there will be any penalties from the school if the children do not attend, and that was a question for Sue.
Great minds think alike, Councillor Marshall. Sue, please.
Yeah, thank you for that question. I've been working with the attendance team, and we'll be discussing this at leadership team this week as well. But our view is that if a child has been advised not to attend school because of medical reasons, either their own health or that of a parent, then that is, we as a local authority, we'd be proposing that we wouldn't fine those parents. So that's something that we'll be discussing this week at our leadership team, but certainly that's our view.
Okay, so they will need to have medical evidence, is that correct?
Yes. And as I said, each child who's been on the shielding list is being assessed at the moment, so that evidence will be available. And as I'm working with my adult colleagues around, so we'll be able to provide that information.
Okay, no, it's not in this circumstance, it's not the child that is shielding, it's the parent.
Yes, I understand, and we would be asking for information and evidence, and that's something that I know Val probably wants to come in around what that looks like from an education perspective. But I know, as I say, we have had a case where a parent was very concerned about their children attending school because of their own particular health condition, which was, sadly, it was a terminal condition. So there will be some very small number of cases like that where we have to take a particular view.
Yeah, thank you very much.
Val, did you want to come in?
Yes, please.
Yeah.
Just to add into that, there will be some specific cases, and the advice that we're sending out to schools and that we've already sent to schools is to absolutely have those individual conversations with parents where a young person is not attending. And if it is because of those particular personal circumstances, and we can provide the medical backup, the medical advice, then again within the register, the coding for that young person will be that they're absent due to coronavirus. And it's very much to do with the coding within a register of how young people then move towards potentially the fine system. So we've sent out comprehensive advice to schools about the marking of registers, the codes that should be put into place for every individual circumstances with frequently asked questions. And we've basically got a hotline as well coming back into the attendance team, that any school with any concerns about a young person not attending can ring through to us, and then we will support and we will advise on that particular case.
Thank you, Val. Councillor Marshall Catong, are you happy with those answers? Did you want to follow up on anything?
I'm very happy. Thank you.
Thank you very much. Can I just check, Councillor Forsyth, you did have your hand up for quite a while. Perhaps your question's been asked because it's gone down again.
Yes, thank you very much. It was specifically about the laptops, but it was something else as well. But thank you very much for the comprehensive answers and also for the comprehensive report. And I just wanted to say a very big thank you to the Directorate and to head teachers and teachers throughout this really difficult time. So thanks.
Okay, thank you, Councillor Forsyth. So I've got Kate next, please.
Thank you. Just a couple of questions. The first one was just to ask around schools obviously being a very different place for children and young people now than they were when many of them last attended in March. And we've talked quite a lot about children who are have either been shielding or their parents have been shielding, or children who already have existing EHC plans due to perhaps already existing needs. And I'm just wondering about how children and young people who may have developed anxieties or mental health issues during the course of the pandemic, or who may develop such difficulties on returning to school in such a different environment and in remaining uncertainty, particularly as we hear on the news obviously about things like restrictions being reintroduced. I wondered what additional training and support and resources are being made available to staff in school and within clusters to support what I expect will be an increasing pressure on those services. And also, particularly, we have talked a bit about how attendance will be managed in particular circumstances, but particularly perhaps for children who have developed anxieties or mental health issues and are finding attending school within the current environment particularly difficult. How will that, if they're not able to attend, how will they be supported and how will that be viewed and managed? So that's my sort of first question. And then my second question is around remote learning, because obviously the government guidance for returning for schools returning places an obligation on schools to plan for the event of local lockdown, and obviously bubbles being self-isolating and the provision of remote education. And whilst I understand a one-size-fits-all approach won't work for arrangements within schools for children actually attending, I get the impression that there's been quite a lot of discrepancy across the city in terms of the remote learning that was provided during lockdown. And I wondered how the council might be able to support schools and what view it takes around the provision of remote learning, particularly things like online lessons, how we could have a more uniform approach to that, as opposed to a one-size-fits-all, to ensure that should children be at home again due to self-isolating or local lockdown, that children are getting the same access to education across the city, whichever school they're actually attending. Thank you.
Thank you, Kate. I've seen Val's hand go up in response to that. I'm guessing Dave will want to come in as well. Val, do you want to respond?
Yes, so first of all, in response to the first question then around anxiety, absolutely that acknowledgement that there will be a lot of young people that throughout this period who previously did not have identified difficulties may have difficulties now that are associated with social, emotional, mental health. So there's that absolute recognition. And throughout this period, our teams, our services have been working to support schools and clusters, communities in actually providing information, providing resources. So we've put an awful lot of resources that are online for Leeds for Learning and through the local offer. Lots of information gone out to schools as well, so that we're supporting schools in supporting their learners. So there's a whole programme of work that our educational psychologists working with other colleagues in our wellbeing teams have provided for schools and that schools have access to. What we also had notification of just in August, towards the end of August, was a grant that came from the government, which was a Wellbeing for Education Return grant. So altogether across the whole country, there was 8 million that was available for councils to identify to the DfE that they would have a programme that they would like to support within their city. So we made that bid. We received £96,277 for that grant. We've already set up now working groups that are pulling together colleagues from health, education and social care. And the plan at this point is to deliver that through clusters, because within our city we have that great gift of clusters where schools already collaborate and work together, and where we've also got multi-agency teams. And rather than putting something in that would be a one-off support, what we think it would be really good to do is to build the capacity within the cluster, within the teams, within the schools, so they will then have ongoing support, which then builds resilient communities, rather than have somebody that is basically, you know, dropped in to do a particular program or a particular intervention. And part of that whole program is about training and upskilling people, so that that community then becomes resilient, not only in what they can offer individually to young people, but what they can offer then across the whole community, and then how then they can support right the way across into future years. So that's what we are working on at the moment. There's a whole programme of support. We've identified educational psychologists that are linked into each cluster, named psychologists for each individual school. Wherever possible, we've maintained that same educational psychologist that was known to the school, known to the community before COVID, so that we've got continuity now moving through. And as I say, working with colleagues in social care and across all the clusters to also provide that support. The attendance issue has come up numerous times, because we've always had children that, due to anxiety, cannot always access a full programme of support, and schools are well aware of all of that. So really it's upskilling now and actually putting more resources into that. So as Sal said, it's about developing confidence in parents, developing confidence in young people, and then putting individual support programmes in place. So it may be that initially they cannot attend school full time, but they may be able to attend for part-time, may be able to attend certain parts of the curriculum, certain parts of the day. So you do a whole programme of support for that individual learner, working with the family to then enable them to get back into school. Because that is the aim. You know, school is the right place to be. So it's about recognising the needs, supporting those needs, and putting a programme of support in place. The attendance, we are not looking to be punitive. So whilst we absolutely want all children back in school, it's very much about how can we support, how can we develop that young person so that they then can cope with the situation, rather than, you know, in the attendance register marking as absent. So their mark will be a reflection that, due to the circumstances that they're in at this moment at time, it would be a mark to say it's about the coronavirus effects, and we would work with that family young person to get them back into school. So we're not looking to be punitive. That's around that. Thanks.
Could I just add to that, Chair, Councillor Lamb?
Who's that? Sorry.
It's me, it's Julie Longworth.
Oh, sorry, Julie. Yes, go ahead.
Just to reiterate really what Val has said, but I suppose just to add that we have had weekly cluster meetings, which I think we've talked about before in Scrutiny, where our early help practitioners, our social workers meet with targeted services leads, with health colleagues, with a range of other partners at a local level. And that's about constantly taking a proactive approach to identifying those children who may well be struggling, children who may have been vulnerable and may have struggled prior to the pandemic, but equally those children who have developed social, emotional, mental health issues as a consequence of the pandemic. So there's a lot of local work going on to identify those children, to share information in respect of the children and the family, taking that think family approach, and ensuring that there is individual packages of support for every child who falls within that category. And it's something, you know, I think for me, it is about early identification, you know, where we can identify at the earliest opportunity any emerging issues, and then working together as a partnership to address them. You know, that's constant. We've been taking that approach throughout the pandemic, and that continues.
Thank you, Julie. Kate, has that covered your questions, or did you want to come back on anything?
Well, not the remote learning one, I don't think yet, but just on the, so in terms of if a young person needs that help and support, what are the waiting lists like now then for that specialist support that they might need through the cluster? Are they, I mean, we know that they were already sort of longer than we would have liked. And I guess if there's more pressure on the services, is there additional resources there to sort of maintain or reduce those waiting times, or are they increasing?
So I think, and what I'd say is it's a real mix, you know. So obviously, as you've said there, Kate, there is resource available through the clusters. So really early help resource, and that's about what the clusters have commissioned, what the local schools have commissioned locally. In addition to that, there's a whole range of services, you know, whether those are services delivered through the voluntary sector. We've now got the early help hubs in place, where we've got mental health specialists based in the early help hubs. We're constantly looking at funding opportunities, you know, so we have just put in another bid around some funding to look again about transition and supporting the transition of young people back into school. In the current climate, you know, resources are finite, you know, and I can't say otherwise, they are, but I suppose it is about being creative, you know, and looking at actually the resource that we have got, and that's where the partnership work comes into play. So really linking in with MindMate, linking in with our, you know, educational psychologists now being based in the hubs. So there's something about, I suppose, that whole notion of working together and this being everybody's business. And I suppose that approach which Val has just described, so that additional funding that's coming into the city, what we're using that to is to upskill the whole of the workforce, you know, so that everybody across that workforce is better equipped to respond to needs like this. And I think that's the way that we've got to go, you know. Whilst there's a place absolutely for individual specialist services, what we're really wanting to do is to bring the knowledge and the experience of the whole of the workforce up across the piece.
Thank you, Julie. Dave, did you want to come in on the remote learning, please?
Yeah, if I just mention about the remote learning in terms of, I think when lockdown occurred, so when schools moved into this sort of in March, April time, there was schools, we were never ready for educating children remotely in that sense. So I guess you're right in terms of schools, head teachers worked incredibly hard to get as much as they could possibly put in place for all their children to be learning at home. I mean, I'm a head teacher, and running schools is complex enough without sort of all your kids all over the place and, you know, all the situation they found themselves in. I think what I would say, however, is schools are incredibly good at responding to the situation and putting things in place. And I think one of the things, you know, we've all got used to working in a different way. And I think schools have also been responding to that really well. So I think they will be better in terms of getting their systems in place. They would have been faced with a situation where some schools had ready to go platforms to work with the kids virtually. Some schools wouldn't have, so they've had to like put in place all sorts of different systems and procedures, and they would have had some staff that would have been more able to do certain things, ways of learning. It's been a real complex situation, I think. So that's where I think there has been often differences in the provision for different groups of young people. I think that schools have now got moved forward and things are better, so they're more prepared for that future potential of local lockdown or kids having to self-isolate. And I think that they've been more aware of it. I'm sure that that the head teachers have been thinking through. They know that that's part of the new normal, really. So I think they're preparing more for that. Systems are more in place, and I think over this, I think the key thing at the moment is getting the schools back, and for head teachers and school leaders to get things happening physically at school. But I certainly know from my discussions with head teachers that that's something very much on their radar, in terms of they've been planning already for what happens if. And I think it'll be part of our discussions with, as part of the Bronze Group, where we sort of bring in solutions. So head teachers have done some amazing sharing of the work that they've been doing in their school and the planning and some of the plans that they've had to put in place are just phenomenal in terms of the work that they've had to put in. But I think that's something that we can look at in the bronze groups, is how do we best share practice of how schools are operating that remote learning, and then we can share that wider amongst the city. I think there will be, I mean, with the best one in the world, I think it's difficult to say this is how you will do remote learning, because even just on the nature of schools have different ICT platforms, different support networks, it's very difficult to say this is what you have to do, because that will cause more problems. But I think what we can do, and we've got a lot of online resources, and the government have put online learning resources available. We're doing the same as a local authority, where teachers can access things to get, you know, from a central base. And then actually part of our other way that we can support is by having those discussions and trying to share that best practice around the city. So yeah.
Thank you, Dave.
Thank you, Dave.
That's great. Thank you.
So can I just bring in Councillor Venner, please, on the mental health aspect?
Thank you, Chair. I just wanted to reassure board members that Future in Mind has met right through the pandemic. That's the board that I chair that brings together health, the council, third sector and young people themselves in the form of my ambassadors to look at mental health and wellbeing for children and young people across the city. And we've met right the way through to look at what children's mental health needs are during the pandemic, what they may be going forward, and what planning services need to do from both the commissioning and delivery perspective. And the Future Mind strategy is actually due to be updated next year. So we've started that piece of work now, very much updating it in the context of COVID and the contextual factors that will impact on children and young people's mental health, like the huge increase in child poverty. So that's a piece of work that's going on at a strategic level. I just also wanted to mention that although the length of CAMHS waiting lists is very well documented nationally, as well as locally, there are some mental health services locally that children and young people can access on the day that they need them. So the Team Connect helpline that Leeds Survival Aid Crisis Service deliver, it's had a big increase in calls over this period. They now support 11 to 17-year-olds, and they're open from, I think it's now 3:30 in the afternoon. I think it's 3:30 till in the afternoon till 2 in the morning. Over this period, the Marketplace and Leeds Survival Aid Crisis Service launched Safe Zone, which was always meant to be a place young people would go for face-to-face support that's open 3 nights a week, Sunday, Monday and Thursday. They've been delivering that support through Zoom, I believe, but are now moving to face-to-face support. But both those services are services young people ring on the night that they need them. And then in the last year, the CAMHS service have launched its own young person specific mental health crisis team as well, which wasn't in existence before. That's also come out of Future in Mind's work. So I just wanted to reassure the board really that we do recognise that a huge impact on children and young people of the pandemic is the mental health impact, and we are working on making sure that young people can access the support they need, because the mental health impact will go on longer than the virus, and we will need to be set up as a city for addressing that across health and the council and the third sector. Thank you.
Okay, thank you. And Val, did you want to come in on this as well?
Just really very, very quickly, that whilst we do have an awful a wealth of services now that are working together to provide that individual support, as Councillor Venner has just outlined, and all the work that's gone on with Future in Mind, I think one of the important things just to mention is very much that it's about building that resilience within the community itself, because an awful lot of children may have initial difficulties with anxiety, initial difficulties in that making that first step, but actually then it's about that resilient community where there is a safe space to share, to talk, and then that community itself can put the support in place without needing to go on to further clinical services for an awful lot of children. And I just think it's worth reiterating that for an awful lot of children, initial anxiety, absolutely normal, absolutely natural to feel that moving back into school. And it's that community that are going to support that young person. It's those that get stuck. It's those learners that can't get over that initial anxiety and then need something more, where we then do have the services to support individuals. Thank you.
Thank you. Kate, does that answer all your questions? Did you have any follow-up?
No, that's great. And nothing was intended as a criticism either, just to add, just think the work's been fantastic and it's really encouraging to hear everything that's been said. Thank you.
Okay, thank you very much, Kate. So I've got a couple of hands still up. I'm going to check if they've been left up or if you have additional points. So Councillor Renshaw first. Did you want to come back?
Yes, please.
Yep, go ahead.
Just a minute. Thank you. I was pleased to hear from Val that the amount of funding that's been sent out from central government. I just wondered if the academies were receiving any added funding directly from the government, like they normally get the funding through. So if you could just enlighten and let me know if they are doing, or if it's all coming through the council.
Okay, thank you. Is that Val or Dave to pick that up?
I mean, in terms of the grant that has come through, the Wellbeing for Education Return grant, that's come directly into councils. So it would include supporting academies because it was an offer across the entire city, but it's come into the local council. I'm not aware of other specific grants going specifically into academies. I don't know if Dave, if you're aware of anything.
No, I think the in terms of, I don't know, in terms of things that come across, for example, the laptops and things like that. If money's been directed towards academy school, it's been shared on an equal footing. Either the money's come, but it's either been split between, it's gone direct to academies and the local authority's taken the maintained sector, or it's come to the local authority and it's been checked. So I think there's been an equity around academies and maintained having the same access to the funding.
Okay, thank you for that. So I've got Helen next and then Councillor Harlan.
Hi again. I just wanted to ask about the whole school risk assessments. I noticed yesterday that there is still, well, I just had 5 minutes and I was looking at different schools in the locality, and of the 6, 5 of which were primary, 1 was the high school, none of them had the risk assessment on the website. Now, whether it was just that I couldn't find it, but I did, you know, I really tried to find it. And I just think really for parents, that is the first line for them to have that reassurance that school is safe, and having that risk assessment on the website may mean that other agencies or groups don't need to put in the work to get those children and parents reassured and back to school. So I just think that it's really, really important that all these schools that do not have that risk assessment on the website need to get it there. I think it's quite frustrating, really.
Yeah, and I think Helen, we've sort of asked schools a number of times to make sure that's done, but we can certainly reinforce that again, that actually, and we've said that, like you know, your point about sort of like people having access to those so that they can find the information that they need to build that confidence, to be reassured. So yes, we'll send that message out again.
Okay, thank you for that, Dave. Councillor Harlan, please.
Thank you, Chair. Just a comment. Councillor Venner made reference to our youth services in her introductory comments. And I'd just like it noted that in the outer south and east areas, the youth service have been absolutely phenomenal throughout this, working with groups of young kids gathering in areas that they really shouldn't have been gathering in. And just to, as I say, make reference that they've gone above and beyond. And ward members in Kippax and Methla particularly thank them. Thank you.
Thank you for that, Councillor Harlan. Okay, so that's everyone I think that wanted to speak. So if I just go perhaps across Sal and then Councillor Venner and Councillor Pryor, just for any summing up comments. Just one final thought from me which you might want to think about when you respond is we do need to look at other things we want to focus on in more detail through the year. And I wonder if we can reflect on how we think perhaps about the longer term impacts that we've heard of today. A lot of the folks have been on quite understandably safely getting children and staff back to school, but it's really incumbent on us as well to think about what the long-term effects, not only in terms of educational outcomes, but mental health, and how we would measure and monitor that going forward. So perhaps if I can go to Sal first, and then Councillor Venner and Councillor Pryor to sum up.
Yeah, thanks, Councillor Lamb. So my appreciation for all those points and questions. I think we, in addition to the report with that discussion, I think that is a comprehensive picture of where we are at the moment, and there's been some helpful points made there that we can pick up outside of the meeting and progress. So happy with all of that. I think we've said that in October we'll have a bit more of a sense of what the data is starting to look like in terms of attendance. We'll be able to see what referral patterns and service demand looks like across social care and early help, so we'll be able to report into that. I think we'll be starting, it will still be, I guess, an early picture of what we are picking up, and given the way that the infection rates are increasing at the moment across the country and across the city, we'll need to take into account where we are with the pandemic as a whole. I would have thought that through to the end of the year, we'd want to be keeping an eye on all of those things about how we got the system set up, what are we learning from children now being back in school, both in an immediate and maybe a more medium-term sense. And then perhaps in the new year, we'd be looking towards what are the long-term implications, and whether we've had sufficient enough time for kids to be back in school to be understanding the patterns that are emerging and the response that's necessary over a longer period of time.
Okay, thank you, Sal. Councillor Venner, any final thoughts or comments from you, please?
Thank you, Chair. I did just want to respond actually to Councillor Harlan's comment about the youth service. They have been an example of the great flexibility that our staff have shown during this period. They haven't been able to obviously do much, do a lot of the youth work in the way it would usually be done. They are starting to get back to that now, and they really have adapted to where they've been needed. So as well as doing work with Safer Leeds, particularly where we've had difficulties with young people congregating during lockdown and not following the guidelines, we also have had youth workers deployed into our children's homes, which has kept them fully staffed and operating as usual when we've had staff who've needed to shield or self-isolate. So they have been really fantastic. In terms of your query, Chair, about priorities going forward, people will have heard me say this before at this meeting and at other meetings, but my view is that the impacts on children and young people going forward will be primarily in relation to child poverty. We had around 33,500 children living in poverty pre-COVID. That will have gone up hugely in terms of families that were just about coping on low wages, 0 hours contracts, self-employment who've fallen off a financial cliff during this period. And then young people have been the most affected group in terms of losing jobs in areas like hospitality. So there's expected to be a big issue around youth unemployment in 16 to 25-year-olds. And then we've already referred to mental health as well, and the mental health impact of the pandemic, particularly in relation to children who may have experienced issues like bereavement, family breakdown, witnessing domestic violence during lockdown. So my view would be that child poverty and mental health are going to be the biggest impacts going forward, and that they will fall very much on the shoulders of young people for a long time to come. Thank you.
Thank you, Councillor Venner. And Councillor Pryor, any final thoughts from you, please?
Yeah, I mean, first of all, I'd agree completely with everything Sal and Councillor Venner have said, particularly reiterating those points Councillor Venner made around mental health of children. I think that needs to be the priority for schools at the moment. I think talking about kind of learning and learning well, that doesn't happen until you have kind of the mental health and the pastoral stuff in place first. So kind of following on from that, I think the thing I'll be looking from an education perspective most closely at over the next few weeks is how exams or a non-exam period is going to work for 2021. I think we've seen what happens when that goes wrong, and I think we've got however many months, 9-10 months now to get that right for next year. I don't think it can be the same as normal. You know, children have missed a large chunk of their education. So I think we need to be looking at how that's managed.
Okay, thank you, Councillor Pryor, and thank you to everyone for your contributions in that session. So we move on now to item 8, which is our scrutiny inquiry into exclusions, elective home education and off-rolling, and a summary of evidence to date. Now, it seems probably about 100 years ago that we started this inquiry. It's been quite a lot happened since. I think we have to make sure we're clear that this is no less important than it was when we started looking at it. And while there are clearly other priorities and urgent things that have come along, it mustn't drop off our radar. So I'm going to hand over to Angela to sort of reaffirm where we are and propose the next steps from here. So Angela, over to you, please.
Thank you, Chair. As you mentioned, it was last year that this Scrutiny Board had commenced the inquiry. And while the board had already acknowledged back in early March that its inquiry would need to continue into this next municipal year, it was the COVID pandemic emergency that led to the board then prioritising its attention on how the council and its partners are working collaboratively to support all children and their families during this unprecedented and difficult period. So consequently, the board's inquiry work had been paused temporarily. So the purpose of this report is to remind members of the position that was reached by the Scrutiny Board during this inquiry, with a summary of evidence document attached for members' information. So this summarises the information and the key issues that were raised during the inquiry sessions that were held in February and in March. The Scrutiny Board had originally planned to use its meeting in April to primarily consider the findings of the RSA, who had undertaken its own research on school exclusions, with Leeds City Council and local schools actually being key partners in this research project. However, as the April meeting was cancelled due to the pandemic, a copy of the RSA research report has now been provided for members' information. And you will note that there are some positive references made to the work being undertaken in Leeds within that report, particularly in relation to the restorative practice programme, references to child-friendly Leeds, the links to the 3A strategy, and particularly the work of the Leeds Area Inclusion Partnerships that's delivering services to children at risk of exclusion. So this research report will remain a key part of the evidence base when the board does resume its inquiry work. The pandemic emergency had also impacted on the Scrutiny Board's plans to undertake survey work with local head teachers and chairs of governors, as well as arrangements to undertake a visit to the Leeds City College, the 14 to 16 Academy. So such plans will therefore also need to be revisited once a suitable time frame for resuming the inquiry has been agreed by the board. So linked to this, I think we'll agree it was obviously clear that the pandemic response has also had a profound impact on local schools and will continue to do so in the coming months, as their primary focus remains on building the confidence of staff and families in managing that effective and safe return to schools. So it's therefore been proposed that the Scrutiny Board's inquiry is paused until at least January 2021, and that members review the position again at that stage in order to identify a suitable timeframe for resuming the inquiry. So through you, Chair, just welcome any views or questions that board members may have at this point. Thank you.
Thank you, Angela. I think that was pretty comprehensive, but if anyone's got any questions or comments about that approach, Jackie, please.
Right, can everybody hear me? I just want to really just thank the directorate and everybody, you know, that we've such good things in the report, you know, like restorative practice, rethink Leeds and child-friendly Leeds, and we are making a name for ourselves in Leeds, and I think we've done really well. I've been involved with, you know, in this scrutiny board for the last 10 years, and I can see, you know, how we have moved from, you know, requirement improvement all the way through now where we're outstanding. So I think we've done well, I think, and I'd like to, even during the pandemic, the amount of work that has been done. And I think I'd like to thank everybody on behalf of, you know, I think it's been really, really work. You know, I'm proud of Leeds and I think we've done really well. So there we go. They're my comments.
Thank you for that, Jackie. I've got Councillor Forsyth also with a comment, please.
All right, thank you very much. I think my comment falls between what we've just been discussing and this work going forward, which obviously I would agree that we need to pause this at this point. One group that I haven't heard mentioned really is this year's NEETs. And I'm just wondering, we're thinking about obviously all the pupils going back to school, but I'm thinking about that cohort of possible last year's year 11s and whether any of the officers have got any comments to make about that and where that might fit in terms of the work that we were looking on exclusions.
Okay, Dave, could you want to respond to that?
I'm happy to come in, Councillor Lamb.
Okay, so thank
you. Just say that Councillor Forsyth, you did cut out just then. I think I heard you say we're looking at those young people who are not in employment, education and training. We do keep a closely monitor this, and part of our youth service are dedicated to working with those young people. So the monitoring arrangements remain in place, and as Councillor Venner said, our youth work service have been particularly flexible in terms of supporting priority areas of work as we've gone through the pandemic, but this is an area of work that they will now pick up. I think in general terms, whilst I agree with the approach in terms of pausing that particular inquiry, the issues that are raised in relation to the reports that we've got in front of us are things that we will be monitoring closely and working with all the way through. So I think you'll continue to get some information about all of those areas as we continue through the autumn. But in terms of the formal inquiry here, I think I agree that we revisit where we need to go in January.
Okay, thank you, Sal. Councillor Harlan, your hand is still up. I don't know if it's still up from the previous time or if you had a comment. Councillor Harlan, are you there? No, we seem to have lost Councillor Harlan. So I think it was just left up from the previous question. So I think that's all the points. So I take it that everyone's happy with the proposal that we're going to take that forward into January. So we move on therefore to item 9, which is the work schedule. And again, I hand over to Angela to present that item, please.
Thank you, Chair. Yes, this report presents the latest version of the board's work schedule for consideration and agreement of the board. With regards to the next meeting, the board is receiving a specific recovery planning update relating to schools in Leeds. Also scheduled for October is an item on budget saving proposals. So initial proposals relating to the budget are expected to be considered by Executive Board in September, with a view to consultation on those taking place during the autumn. So as part of that consultation process, it was agreed with all scrutiny chairs that the proposals being taken in September would be formally considered by each scrutiny board as related to their specific remits during their October meeting cycle. So that's been added in for the next meeting. However, prior to the Scrutiny Board's meeting on the 7th of October, a remote working group has also been planned for the 30th of October at 1:30 p.m. And this is to provide the opportunity for board members to discuss the option appraisal process that was linked to the development of budget saving proposals. So invitations, Chair, will be sent to all board members to attend this working group. Through you, Chair, I know we've heard already from the Director and executive members about some of the key areas, priorities for further work, but members are now asked to consider and agree or make any further suggested amendments to their work schedule at this stage. Thank you.
Thank you, Angela. So again, I think that's pretty comprehensive. We've got plans in place for our meetings for the rest of the year now. So does anyone have any questions or comments about any of that? I'm not seeing any hands going up, so I'll take it that everyone's content. I think all that remains then is for me to thank everybody for their attendance and contributions. We've covered a lot of ground again this morning, and the date and time of our next meeting is the 7th of October at 10 a.m. Now, depending on the situation at the time, there is potential that that could be a hybrid meeting. So for those people that are happy and able to, they could attend Civic Hall in rooms 6 and 7. And for those that are not comfortable, there'll still be the option to dial in on Zoom, but that very much depends on the circumstances at the time. So we'll keep people posted and confirm as things go along. But other than that, if I can just thank you all again for your contributions, and see you roughly the same time next month. Thank you very much.
Thank you. Bye.
Thank you. Bye.